So tonight, I don't have a lot of really new information, but I do want to go through the metrics of COVID and talk briefly about where we are with monkeypox. And because things have been kind of steady as we go, I'm not planning to do this every week, but tonight especially is that point, as I mentioned last week, where every 8 weeks I take a look at US versus world numbers to see how things are going. And this happens to be the 8th week. So I wanted to at least share that at least one more time. And then depending in the future as to what's happening, we'll see what we do from there on. So this week, a couple of things have happened in the numbers. First of all, we have seen a reduction in cases, and we've actually seen that for the last few weeks. So if you take a look here at the curve, we have seen a pretty steady improvement from the middle of July to the present time. And last week we had finally broken the 100,000 per day average as far as new cases. This week it's dropped to 87,000 per day. So that's a really good trend as far as just seeing what is going on overall. As I've mentioned in the past, those numbers are still relative because of the number of in-home tests, but we do know that everybody that's comes into the hospital is automatically going to get a COVID test. So that's part of the official count. And there still are quite a few people that are getting tested at the public testing centers, and those are all part of that. Now, the bad news is that we've seen an increase in the number of deaths this week. So this is compared to the week before. We had a 39% increase in the number of deaths in the United States. So we had 3,800 new deaths this week. Oh no, Siri, I'm not talking to you. Sorry, let me make her go away. So we saw this increase in the number of deaths in the United States, and that in turn means that our average, as far as our mortality, is continuing to worsen. So last week we saw the 2-week average of deaths at 0.49%. This week it's over 0.5%. So gradually we are seeing the mortality worsen at the same time that the number of cases are reducing. If they were reducing at the same pace, we would actually see that kind of staying steady. But right now things are heading in the wrong direction as far as mortality. Worldwide, we are looking at approaching 6.5 million deaths worldwide. So probably by next week, we will hit that number as far as the number of people who have passed away around the world. Right now in the United States, cumulative death count is over 1 million, and that's reflected in this 37 or 3,800 deaths that we experienced this past week. Any questions or comments about those numbers?
I do, of course.
Okay.
I'm beginning to think that's got to be something besides, in the United States, besides not being vaccinated. I'm curious if there's any indication in these figures anywhere of what the metric looks like of the person who's dying now. It's going to be older, I'm sure, and it's going to be unvaccinated, I'm sure, but there's going to have to be other things, because I'm sure that we have a relatively high, compared to places, to other continents, of people who are vaccinated. Or is that an absolute wacko thought?
Worldwide, we are terrible in vaccinations. We have 65% of the population is vaccinated. Most of the world is at 80 and higher percentage of vaccinations.
Well, that explains something.
Yeah, so that's a huge part of it. I didn't pull the rankings for deaths, but I did pull the rankings for hospitalizations for this week, and you're right, the number of people who are seeing severe illness and death are definitely in the higher age range. And then, of course, the United States has a really high incidence of diabetes and other comorbidities that the rest of the world is not experiencing. Our poor health, our poor diet rather, and low exercise and fitness compared to the rest of the world is also relatively bad. So even though we have good doctors and good hospitals, we have an unhealthy clientele. Yeah. I will, if I do this again next week, I will see if I can pull the numbers around deaths broken out by age. But as we'll see in a minute, the number of hospitalizations broken out by age and the number of hospitalizations compared to vaccinations continues to just really be kind of a sad state of affairs.
I'm not sure if the word comorbidity is the right one to use, but in addition to age and vaccination status, it would be interesting if other things, you said diabetes is showing up among the people who are dying. I'd be really interested to know what other identifiable characteristics are showing up.
So through the whole pandemic, the comorbidities have been diabetes, heart condition, cancers. So there are all of these other illnesses that, especially as people age, become already a health threat, and then COVID is like the additional burden that the body has to deal with. Yeah. But actually, in the way that deaths are counted, so these numbers that are over here only count a COVID death if COVID is one of the primary factors on the death certificate. So we aren't counting over here people who died of diabetes who happen to have COVID as well, if COVID was not the reason that they were hospitalized. So this is looking at just the ones who had on their death certificate COVID as one, maybe the only, but oftentimes one of the combined causes of death. But if it was that the person had COVID and died of something else, they are not supposed to be in this list. Now over here on the left, the number of cases is everybody. So it's if you came into the hospital because of COVID symptoms, you're counted. But if you also came into the hospital because of a broken leg and happened to test positive for COVID when you came in the door, you're also counted over here. So over here on the left, it's a combination. On the right, if the death metrics or the death certificates are filled out correctly, it only should be because COVID was involved with that person's death.
Thank you.
And I'll see next week if I can break out the actual numbers a little more specifically. So this is what the world looks like. The world compared to the US, which let me just back up to the previous one. The US has really been at this plateau since early May. What the world has done in that same period is seen a reduction in the number of cases. And I'll back up again as far as the deaths are concerned. We have been plateaued and slightly elevating as we've gone. 553 compared to where we were in July is still about twice of what we had at the end of the Delta interval. Whereas the world is seeing the number of deaths dropping at a more noticeable rate. And this for the world is the average as of today's data, which is worldwide. The average number of daily deaths is 2,200, of which 500 of those are United States citizens. So so that is kind of a comparison of how the US and the world are compared to each other. Then if we take a look at these graphs, these are the ones that I keep I use a 8-week interval. So that instead of seeing all those little bumps and dips that are a daily change in the way the metrics are reported, which I do smooth out, there's a 7-day averaging there so that they're not as spiky as the actual daily numbers, but still there is some tendency to make it harder to see what's happening. So by looking at it every 8 weeks, it is saying how many cases happened worldwide, which is the total, including US cases, which is the blue curve, and then how many of those were US cases, and then calculating the percentage difference between those. How many of the United States reported cases make up the world's total? And what
did you change slides?
Yes.
Mine did not move.
Uh-oh. You know what? It says here my screen sharing is paused. Isn't that weird? I'm going to stop and restart. I don't know.
Thank you.
Yeah, thank you.
I hated to interrupt your flow, but I was going,
no,
what am I missing?
If it wasn't working, then we should interrupt it. How's that? Is it a different slide now?
Yes, thank you.
Cool. Let me know if that happens again. And actually, I did notice after you told me that there was a little orange note up here that said that my sharing had stopped. So who knows why? So this is the comparison of the world, which is the blue curve, and the US, which is the orange curve, and then the calculation of what percentage the US made up of that. you'll see that there was one period in the later March, and that was at the end of the first Omicron wave, but before the second variant came along. So that was at the end of BA.1 and before BA.2 came along and started to push our numbers back up. We were looking really good because at that point we had dropped to 4.8% of the world's total, which had happened one other time during the summer, and that was just as we were coming out of the alpha phase and before we came into the surprise of the Delta peak that came after that. So those 2 points, the United States is doing okay, or really well actually. But for most of it, we have been in that 15 to 25% range of the world's total cases. One of the things that I've mentioned a few times, but I'll just mention again, is the US did not see the spike that other parts of the world did, which was caused by the Gamma variant. And that was one that really impacted Brazil very heavily. At one point, Brazil actually was reporting more cases than the United States for a short period, and India was also affected by that. The United States did not suffer from that particular phase, but then we made up for it when we came along with Delta, and then Omicron .1, and then .2, 3, and 4 as we come down into these. So the story here is that relatively, we most of the time are making up more than our fair share of the cases. Remember that the data source that I use, which is worldometers.net, is looking at 230 nations. So out of the 230 nations, the United States is contributing 12.6% of the total number of cases. When we take a look at deaths, this is the curve. And again, alpha, gamma, delta, Omicron, you can see that for a period when gamma was really the predominant variant, it was really killing a lot of people worldwide. Relatively speaking, the United States was, I didn't calculate the percentage for that particular spike, but 19%. And we had then around the Delta period, our death rate had dropped to the point where we had dropped to 6.8%. But as the world has continued to do better and better as far as their mortality, the United States has not really kept pace. It's kept pace, I guess, in that we are at about the same percentage, but we're not getting better. So we have always hung around this 20% from the point where Omicron started, which was Thanksgiving of last year, to our present time. So the number of deaths that we are contributing that are recorded as caused by or associated with Omicron or with COVID rather, is still maintaining at that unnaturally high percentage compared to what the rest of the world is doing. But the good news is worldwide, we are seeing the trend being fewer and fewer people are dying as more and more people are becoming immune either through vaccinations or through recovery from a infection. Comments about that? Okay, and if we're still doing this 8 weeks from now, we'll look at how it's doing at that time. This is the excuse me. This is the curve of hospitalizations, which breaks it out by age, and we'll see that people over the age of 70, as far as hospitalizations, continue to be the largest number. But we also see that since early July, that the numbers are improving at a fairly noticeable pace. The other age ranges, so this is 60 to 69, the dotted line is all ages combined. The teal line is 50 to 59. The lighter green line is 30 to 49, and then the yellow line is under 18. So you can see that all of the hospitalizations are improving, particularly the top two curves, which would be over 70 and over 60. We are starting to see the number of hospitalizations improve in both of those areas over the last month or so. Questions or comments?
Greg,
Yes.
the downsize from 20 days in the hospital to 10 days in the hospital, is that more likely that they're getting out alive also?
I didn't catch that. 20 days? I don't know where you.
Okay, so this curves are how many days in the hospital, right? 10 day. Is it 20 admissions or 20 days?
So this is No, this is admissions. The United States never, there were only 13 states that ever reported the total number of patients in the hospital. The rest are only reporting instantaneous numbers.
And nobody is reporting how many days, how
Correct.
many days.
Well,
they
only
stay in.
those 13 states you could extrapolate from the number of people and and then you compare it to the instantaneous times. You could calculate those, but that was only 13 states. So you can't really extrapolate to the other 47 states what that really means. So the answer is nobody knows how long the person was in the hospital, but these are the daily totals at that particular instance, right? And these are per 100,000. So this is not raw, but this is compared to the population. And so this is going to be looking at really the relative number, no matter what the population density of any particular area is. It's all amalgamated into a single number per capita.
Is it by any chance? Is it by any chance graphed by region of the United States?
You would have to go to each state. Each state would have its own reporting. I used to follow the University of Minnesota. They actually did all 50 states, of which there was always a few states that didn't ever report. Idaho and Oklahoma just refused to put numbers into that. So it was 49 of the 51 territories. I stopped following that because that was really hard to kind of dissect into 50 different chunks. So this is from the New York Times, who looks at the whole nation. Now, actually, let me correct that. If you go to the New York Times website that I picked this graph up, they do have a graph for each state. So you could actually go in there and look at the 50 different states and their little graphs, so you don't get this much resolution, but you can kind of see the trends on a state-by-state basis. But that, to me, is so complicated to try to do into a single slide or a few slides that make sense that I usually don't pull that one. But if you go to the New York Times, and I don't think this is behind the paywall. I think you can still get to this for free. They have some really good data visualization, including this graph, but also state by state as far as hospitalizations and state by state as far as deaths.
Thank you. I don't mean to be dragging people down here. I'm just
no, they're good questions, and I am glad if I can help you along with that. So here's where we are in San Francisco at the moment. Things continue to look really good compared to what we're seeing nationwide. We're down to 149 cases per day. We are coming in, the total for August looks to be around 35 or so. There will be a few more deaths reported as we get partway into September, but it is looking like August is better than last month, or the July was. Hospitalizations are at the lowest they've been for a while. We've only got 66 people hospitalized. And remember, this is hospitalized with COVID or because of COVID. So if we take a look at the last time that Dr. Wachter from UCSF has given his estimate of at least from UCSF's perspective, half of these are not there because of COVID. They just happen to have COVID and are in the hospital. So, and as he had pointed out earlier, when we look back here at the period around the first of the year, 2/3 of the people that were in the hospital with COVID was because of COVID. And now we're looking at somewhere around 50% of the people are there because of COVID. So we can really think in terms of the impact of COVID on San Francisco right now. We probably have around 30 people or so that are there because of illness that has hospitalized them. Testing kind of is doing it's gradually dropping, but it's not dropping precipitously. So we're doing 2,300 tests per day. That would either be entries into a hospital or people that go to public testing sites. Our positivity rate is continued to drop and is now at 8.5%. And then our vaccinations have really not changed over the last few weeks, but our percentages are very high. So in order for it to change a percent, especially because right now the number of people getting vaccinated are relatively low, that would be a very gradual change. So that's not surprising, but our numbers compared to the rest of the world are doing really well, or the rest of the United States rather, are doing very well. This is our positivity curve. I just put that in for your interest to see where we had the peak back at the beginning of Omicron, and now where we are right now at that 8.5% that I just showed you. This one is showing what is happening as far as the number of cases and the number of hospitalizations. So this is the curve that San Francisco has experienced as far as the number of positive cases. Again, that is both people who have been hospitalized or who have been tested because they have symptoms, or maybe they were tested as a side of some other illness that they're working with. So that's not all people that are severely injured or severely ill. And then the hospitalization curve is moving slowly, but as we saw in the slide before, it is continuing to show really improved numbers week by week. And then this one is back to the unvaccinated part of it. So this is San Francisco again, but you can see that the number of people who are testing positive in those official tests have really continued to drop from the 1st of June to where we are right now, which means that the number of people who are contributing to the illness and to those few deaths that we are experiencing are up here in this range. We now are seeing 74% of the people in San Francisco that have tested positive have not been vaccinated. So that curve continues to really show that the vaccines are working. They're doing what they are supposed to do, which is reduce illness and death. Vaccines were never promised to prevent symptoms, although we went through that little period before Alpha came along where people that were vaccinated tended to not have any symptoms at all, but that was a fluke. But what we're really seeing is a really continuous proof that the vaccines work and that they are continuing to help San Francisco as far as our healthy population. Comments on that? All right. This is one last look at the flu season. The flu season this year was very odd in that we saw a spike that is normally going to happen towards the end of the year. We then saw the numbers drop to almost the level that we saw last year. But then there was this scary moment where they didn't drop and stay low, they started to climb. But if we take a look back, they didn't climb too high. The dotted line is the average for the year. So this is the average number of cases for the whole year. And the second spike never got above the average. And then we continued to see it drop down since then. Now, the reason that this is the last look at the 2021 flu season is that the new flu season starts at week 40. And if we take a look at where we are right now, we're at week 35. So in 5 weeks, this is going to be the end of the data that's collected for last year. And the new flu season starts on the 40th week. Which is 5 weeks from now, whatever that's going to be. So the answer is that last year was really good. The other thing is the reminder that now we have to start thinking about our flu shots for next year. I was just I was getting a vaccination yesterday at CVS. The pharmacist reminded me to get my flu shot. I explained I usually wait until October. She said, well, don't wait too long. So in 5 weeks, the flu season starts over, and then we will see next year what happens as far as the number of flu infections that the United States is going to experience. Comments or questions on that one? All right. So there aren't too many new COVID things, but I'll just mention the few. The main one is that last week I was a little pessimistic about this new booster being available in September, the bivalent, which means that it is both the original formula plus it includes the subvariants of BA.4 and BA.5, as well as the original strain. So this is a new formulation that hopefully will really take care of the Omicron outbreak that we've been seeing. Both Pfizer and Moderna were both approved this week, and they both have received the ability to move forward. And in theory, these shots might be available as soon as next week. However, they are not intended to be your primary vaccination. So if you have not been vaccinated previously, you need to start with the conventional vaccine first, the 2 shots, and then 4 months after your second shot, you can then get this new improved version, but you don't start with the bivalent version. You start with the conventional ones. And the 4 weeks is since your last primary shot, if you've just started recently, or 4 weeks since the last time you received a booster. So there is this period between the shots. In fact, I read an article today that says it's not only a good idea, but if you get this next booster too soon, it actually is less effective, because you really need some time for that last shot to take effect before you get this new boost. The new vaccines are good for ages 12 through adult. We don't know yet, as far as startup, whether there's going to be a preference given to at-risk populations, which would be older citizens, as well as people who have other illnesses that could be comorbidities or have immunity issues. However, because the uptake of the previous boosters were so low, we are probably not going to see a long period where they'll be in short supply. So as of right now, only 50% of the United States citizens who were available to get a booster took advantage of that. And of the people who were eligible for a second booster, only a third of the people got boosted. So the chances of this new version suddenly convincing people who have never gotten vaccinated in the past to suddenly decide, oh, you know what, I better do it, is pretty low. So we probably are not going to see much time where there's going to be a shortage of supply, although in the first few weeks it's likely that there will be some rationing that will be needed. Comments about that? All right. And then the monkeypox update, again, there's not too much news. First of all, last week I mentioned that there is an effort to change its name, and they are now at least unofficially referring to it as MPX instead of monkeypox. But if you understand acronyms, you always understand that an acronym stands for something. So it's a change for the better, but maybe not a solution. San Francisco General Hospital vaccination clinic has now reached the point where they have not had to close because of lack of supply. So they continue to have walk-in vaccinations Monday through Saturday, always with the disclaimer, as supplies last. So as long as they have enough vaccines, they will continue. But for the last 2 weeks, they have not had to shut down because they've run out of supply. They are limiting the second doses now. They're saying as of Monday, they're going to start to issue second doses. I am not exactly clear as to whether the second dose is going to be the full dose that's really recommended for that second shot, or whether it's going to be this practice where they've diluted it down so that you get 5 doses out of a single vial. I hope it's the full dose, because that's really how this vaccine was designed to be. But in the first phase, it's only by appointments, and the appointments are going to be for healthcare workers or people who have, through their primary care physicians, have some level of risk that makes that more important. Later, as the number of doses become more available, they will then begin to do some second doses for walk-ins. But at this point, there is no estimate as to when that might take place. And then there are vaccination pop-ups that are available by request from SF, the Department of Health. The easy way is to, if you want to schedule a pop-up MPX vaccination center, you can send an email to this address, mpx@sfdph.org, or you can use this messy link that takes you directly to an online form where you can request that you are in the list for pop-ups. At this point, they can't promise that you'll get the date that you want or the frequency that you want, but they are now starting to make that available as far as a way that San Francisco is going to deal with this on a continuing basis. And I will put this link to the form in the window once I close my sharing, so that if you want to go to that site, you don't have to copy that messy number down. And that's all I have this week. Any questions or comments that anybody wants to talk about?
I'll say that I continue to be incredibly grateful to you for all the work you do. I feel so much more informed and so much more confident the way that I manage myself and I talk with my family and stuff. I'm just really, really grateful, Greg. This is
Well,
like a college class. It's
In half an hour.
in half an hour. Actually, 135 half hours. I guess
Yes,
that's-
exactly. Yes.
That's it. So you get 2 credits. You get
Yeah.
at least 2 credits on that. Well, good. Thank you for that feedback. And it's actually been enjoyable from my perspective too, to be able to add some clarity to this, especially early on. I mean, lately it's been more and more calm because things are improving. But in that the first 2 years, there was so much bad information out there or incomplete information. So the news would pick up the headline, but they wouldn't give you the details. So the headline became a scary thing. So it's been my pleasure to help being a cumulative effect. When I used to do the mailed reports, those went out every week. Well, at first it was 2 times a week to over 100 people on that mail list. So that was a much wider distribution than the dozen or so people that we have here. And when I remember to take the time to post it to you two, we at least do post that back out to my mailing list, as well as post it on the Resilient Diamond Heights Facebook page, so that gets a little bit more use of all this work.